My name is Nisha Patel. I've been a therapist for over 8 years in the Atlanta area. So in my practice, I am trained in DBT, which is dialectical behavior therapy, as well as a few other modes of therapy, hypnotherapy and brain spotting. But I'll focus on DBT today. So DBT stands for dialectical behavior therapy. And so what it is, it's an approach that's used for people that suffer from depression, anxiety, all the way to people who either have self-harm tendencies or actually have thoughts of suicide or attempts. And the way this DBT works is there's 4 components that we go over. There's skills, then there's phone coaching, and there's individual therapy as well. And these include mindfulness, interpersonal effectiveness, emotion regulation, and distress tolerance.
Can you tell me a little bit about how you see it working with the South Asian community? Like, how does that help?
Yeah, absolutely. That's such a good question. I think with the South Asian community, I've really seen it beneficial because it helps with the emotion regulation component. I feel like as South Asians, a lot of people come in and they go 0 to 100, whether it's female, male, whatever it is. Maybe they grew up in a home where they saw a lot of that. So really helping people slow it down and learning how to take control of their emotions so that then they're better able to have relationships with other people as well, and also how to tolerate stress. Because being South Asian, again, we are high achievers and we have a lot of stress and we're actually used to it, so we don't even realize it when we have that much stress. So distress tolerance is really teaching you how, like, even though you can like live it with such high stress, how to actually reduce stress and still function.
That sounds great. How do you see it working with people? What have you seen shift in people after you've done DBT with them?
And with parents, I've seen it work especially well with them learning how to communicate with emotion versus like the you should or you didn't, but really being able to validate their loved ones, because it's becoming more and more common that they're losing relationships and they don't understand why. They just think that, oh, my family needs to toughen it up, it's just the way I am. But they don't have the understanding of how do you validate somebody yet still give them feedback, which is that's essential, right, to being heard. And then for the young adult population, it can be anything from learning about being sober or what, unhealthy drinking habits are, to all the way to also learning how to manage their stress and then regulating the emotions.